Most people have given a urine sample at some point in their lives. There are different tests used to analyze a sample. The urine culture test checks for germs or bacteria in the urine that can cause a urinary tract infection. A urine sample is better to be collected first thing in the morning when the urine is more concentrated. This is how you collect it. First cleanse the urinary opening and then begin to urinate into the toilet because the sample you collect should be from the midstream in order to avoid bacterial contamination. Pass the collection container into the urine stream and fill about half of it, then finish urinating into the toilet and deliver the sample to a laboratory as soon as possible. A lab worker will put some drops of urine in a Petri dish and store it at body temperature so that over the next days any bacteria or yeast in the sample will multiply and grow. The lab worker will then look at the germs under the microscope to identify their type based on shape, size, and color, and will also identify how many are growing. If it is a true infection, usually one type of bacteria dominates. If there are no harmful germs, the test is called negative. If there are bad germs growing, the test is positive and it means that a urinary tract infection is present. The most common germ that causes urinary tract infections is called Escherichia coli, and it is a bacteria that normally lives in our intestines. The results are usually ready in 3 days because this is the time needed for the germs to multiply and grow. If the result is positive, the lab will do an additional test called antibiogram to test which antibiotic has the best chance of fighting the infection, as bacterial infections are treated with antibiotics. In order to get the best results in treating the infection, you should not take any antibiotics before collecting the urine sample, as this can lead to false negative results. But once the sample is collected, you may start taking an antibiotic that your doctor prescribes until the results are ready. After the antibiogram is ready, your doctor might change the treatment according to it. For a successful treatment, also be sure to complete the entire amount of antibiotic prescribed.